Today I'm talking with Dr. Wallace Bellamy. Dr. Wallace, please tell us about your business.
Well, thank you, Kelly. My name is Wallace Bellamy. I'm a dentist, and I've been a dentist for 32 years. I am the owner of Wallace J. Bellamy DMD Family Practice, also known as Fountain Plaza Family Dental. And we're in Elk Grove, California, and we've been there for 25 years.
Tell me about what the plans for your business were prior to COVID.
So our plans pre-COVID were pretty much just a steady growth, 5% growth. I always look for 5% growth over the previous years. So we were doing very well. We were over our projections in March when we got the stay in your home or stay at home order from the governor, which shut us down practically for 10 straight weeks. And I remember the day, it was March 16th, 2020. And we had a little heads up from the Dental Society that this may be coming down because of what was going on around the country. And sure enough, the shelter in place order was given by the governor on the 16th.
Yeah, that date has come up a couple times in our interviews with other businesses. Share with us the journey that you had to take and navigate to reopen or to stay open when that shelter in place was relaxed a little bit.
Well, Kelly, it was probably the most stressful time of my life because I had no clue how long that was going to be and what we were going to be when we came out of it. I made a good note to make sure that I kept my team informed of whatever it is that I knew from both a industry-wide, dental-wise standpoint of what was coming down from the dental industry and the medical industry and the political industry, both nationwide in Washington, D.C. and in Sacramento with my team. And I think the communication with my team was one of the most important things that I actually did. We got introduced to this medium called Zoom, and we held our weekly meetings just to not only keep ourselves informed of what was going on, but to also air out what our grievances or what our fears were. And it was a good bonding somewhat medium to keep us together and keep us informed and to tell everybody, hey, we're going to get through this. We'll be all right.
Right. What kind of operational or procedural things, protocols did you have to put in place to keep your customers safe and also to help your employees feel safe?
So as you know, going to the dentist, it's a personal experience. If you've been with the dentist for quite some time, it's like, hey, how you doing? They're so-and-so. They may end up coming over and giving you a hug, shaking your hand, asking you some questions out in the reception room, and then doing the procedure and then coming back out and having a little bit more social hour and interaction. You may have also picked up a magazine, or if you've had children who went to pediatric dentist, or in my case, I do pediatrics as well, come to my office, they may have played in the toys or gotten in the little area specifically cordoned off for children, which has big stuffed animals in it. Well, post-COVID, those are no longer there. There are no magazines. There is no personal interaction besides checking in by way of text messaging or calling the office, filling out a COVID questionnaire before you step into the office. There is no more reception or waiting room. You go straight from either the outside of the office or your car, in most cases, straight into the reception room after you've had your temperature scanned and you've washed your hands and you've rinsed out with a medicated mouth rinse and you've masked in and masked out as you're transiting between the outside medium, your treatment room, and back to the outside medium again.
Of all of those cautions that you're taking now, what do you foresee staying around after we come out of the pandemic?
It's interesting that I was asked that question quite a number of times. I would say that I'm old enough now that I remember just before I went to dental school, the HIV um, crisis was around the country. And believe it or not, before HIV, most dentists didn't wear gloves, most dentists didn't wear masks. And we can't see ourselves probably being treated by a dental professional now without gloves or masks. So I would imagine that we'll probably see temporal scanners happening for quite some time in the future. As a matter of fact, I believe those will be around for the foreseeable future, if not forever, as a way of just seeing, where you are with your temperature and then doing further testing from there on. Um, I definitely see that you will be asked to wash your hands. You will be asked to use hand sanitizer before entering the office, on exiting the office, before you're coming up to the front to take care of financial matters. Um, there may be some additional things and changes from the patient's point of view. From our point of view, it's important to say that we've always used PPE, especially since the AIDS crisis and HIV crisis back in the 80s. Dentists have always used PPE and we've used it quite effectively. And now we've gone into a phase where we're doing enhanced PPE. And now you're seeing disposable gowns. You're seeing a special type of mask, most notably the N95s and the KN95 mask, the face shields, different types of gloves and things of that nature. And you're seeing now the front office staff members not necessarily wearing the gloves, but definitely now you see them wearing masks and face shields. Going into the future after the pandemic, I'm not so sure about the face shields for the front office people, but I can imagine that the clear acrylic shields now that most not only practices have, but also grocery stores and other retail places have, those will be up for the foreseeable future as well.
And we all know that every one of us has a personal responsibility for safety and public health everywhere we go, grocery store, the dentist, out to grab a slice of pizza. What advice do you have for your customers and the community at large and how to keep us all safe?
Well, just follow the public health guidelines there. Wear a mask, wash your hands. In our office, we'll have you rinse with the medicated mouth rinse before the procedure to keep the likelihood of any kind of irritant at bay. And just be wary of the social distancing for the time being.
From your personal perspective, what are you looking forward to as we come out of this pandemic?
I'm looking forward where I can actually shake someone's hand. Again, we're a personal, small niche practice, and I like to call myself an old country doctor. In the old days, I would sit in front of you, and we would sit in maybe knee to knee, and I would ask you about your family. I would shake your hand. In appropriate situations, patients want to give me a hug, and that's perfectly fine. I can't do that anymore, and I miss that, and my patients miss that too. Yeah, we do the elbow bump, or not even the fist bump. We just do the elbow bump. Some of us will do the kid and play foot bump as well, but it's just not the same. So I'm looking forward to getting back to where I can actually shake somebody's hand.
Absolutely. Thank you so much for talking with me today, and I appreciate your optimism for our future. Are there any other words you'd like to share with our viewers, your neighbors, your colleagues?
No, only that we'll get through this. It's important to know again that dentists have been doing this for decades now. And so we're actually the people that some of the other medical experts will actually turn to and ask about personal protection equipment, PPE, and how to use it and what to use and whatnot. It's safe to come to the dentist. We'll eventually get back to a semblance of normal. Nothing's ever going to be the same again, but we will get back to personal service again.
Agreed. Wonderful. Thank you again for your time today. Be safe.
You too. Thank you for the opportunity.